Good day, everybody. Welcome to Dental Voice, Season 2 with Zyrus. My name is Rolando Mea, and today we have Dr. Holly Ellis. Before we get to Dr. Holly Ellis, who I think you're going to find is incredible, the purpose of Dental Voice is to have an opportunity to hear directly from dentists, from professionals in our industry, and understand the experiences, the perspective, and even get some advice from them. Dr. Holly Ellis owns a practice, Ellis Dental, in St. Louis, Missouri. She graduated from UMKC, University of, I want to say Massachusetts, but that's not right. No, University of Missouri, Kansas City. Sorry, I'm going to get more focused here. She is a certified board sleep dental medicine clinician, and her practice has been now, oh, goodness gracious, we'll hear about that. Thank you for joining us. How are you, Dr. Holly?
I'm wonderful. How are you doing, Rolando?
Awesome. I want to jump right in here and ask you. So you now have been in practice, and your practice, we've all started coming back, and you're treating patients again. What is the experience you're currently having with regard to everything that we're going through with regard to COVID, this pandemic, and getting your patients back?
Well, I'm pretty fortunate that we closed for 2 months, and when we came back, our patients were ready to come back with us. So we really haven't seen the delay in patient care. Our patients are ready, but we're also ready, and we're moving forward. We just look a little different with our PPE. But I have found our patients were ready to come back. They missed the care that they were used to receiving. The people that were due for hygiene jumped right on as soon as we invited them to. And it's been good. You know, we actually purchased a practice over COVID because what else would we do? And a colleague down the street was ready to retire and did not want to return to all the new regulations and PPE, and it was a good time. So it was a perfect merger. So we took that on. So that's kept us busy too. His patients were more overdue than my patients. So working them in, and we've been busy. I mean, I think we've been blessed that we're busy, but our patients were ready, and my team and I were not afraid to treat them. So I think that helps. They don't see any fear in us. We're ready, we're safe, and they're back.
Well, first of all, it's so good to hear that. We're hearing so many different experiences that clinicians are having in this post-COVID environment and what's going on. How, I mean, it feels like there wasn't, or share with me the stress, or did you have stress with regard to coming back? And I mean, you actually acquired another practice. That's incredible. That's fantastic. But how are you navigating through that stress?
Not by myself. You know, luckily I'm connected through several groups that guide me. So I am a single practice owner. However, I look to peers and colleagues to help me, especially through something like this, right? Nobody had preparation on how to deal with a pandemic or a shutdown. I mean, never would I have imagined I had to shut down my business. But I'm a part of Smile Source, a national group of private practicing dentists. And so we have a lot of message boards that we utilize. And over the closure during COVID, we relied on each other, honestly, to help each other. What resources were we using? You know, when the PPP loan came out, that was a big stressor. My goal was just not to let my team see me stressed and keep them positive that we were going to come back and we were going to do so in a safe way. And then my goal was just to make sure we did that, you know, make sure the resources were in place, make sure I was communicating with them. And yeah, so Smile Source was huge. I leaned on my colleagues there. And then I also work with consultants who have, you know, a group of clients around the country, and they had us together on a thread where we could touch base and we could find out what resources did we need to go to, what was fact, what was fiction. And again, even through the United States and all of my colleagues, we all had a different take on it. Some people were ready to come back. Some people, states wouldn't allow them to come back. Missouri was not as clear. So we could have stayed open, I believe, had we chosen to. But come May, we were allowed to really come back. And so we chose to come back middle of May. And my goal was just to make sure we were ready to come back and we were safe. And so far, so good.
It's great to hear, because first of all, I forgot to mention, you are an administrator with Smile Source, and we've had several of your colleagues on, and the community apparently is incredibly powerful in sharing information. We'll get to that in a little bit. It's interesting, and I'm curious to understand your team, well, not your team, clinicians and their teams had trepidation, anxiety, because when you think about the experience with COVID, there was so much information about how dangerous, how it spread. This whole context of aerosols was a big issue. How did you kind of get to where you are? What was the decision process? And then what are you doing to maintain the kind of the safety aspect and reassuring your team that everything is good, as well as your patients?
Sure. We had measures in place, right? For years, we've been treating all of our patients with universal precautions. So we've always been using our gloves and our masks. We just felt, based on colleagues and the ADA, Smile Source, be what it may, the recommendations from them were to step it up a notch. That's how I took it. Like, let's just step it up a notch, right? So we had ISO dry already in our practice. However, we only used it when we wanted to use it, when we felt it might benefit us. So we just took a turn and ordered more, right? We made sure we had enough setups in every operatory. And I encouraged my staff that week before we came back, they had to come in, practice using them as just an extra way to keep our aerosols down. And so I thought that would be nice for our patients to see that, to feel it, and know that we were doing that for them and ourselves. We ordered new gowns to wear. And again, there were opinions on that all over the board. So I went with what I felt was best. I wanted one that we could wear all day, that we weren't changing all day, but was safe to wipe down and launder. I didn't want a disposable one. So it was going through finding that. And, then there were certain things I kept optional for my team. We all started wearing N95s or level 3 masks, but some people felt more comfortable with a shield. So we had shields. I personally have a hard time working in a shield, so I don't. But we make sure we have the correct eyewear. And some of the girls like the head caps. So for them, I said, go for it. For me, I'm not a head cap wearer. But we made sure, we had the temperatures being taken, and the questions now are different that we ask our patients, and they're getting calls ahead of appointments. But just adding those little touches to our practice, from the ISO dry in every operatory and using it all of the time, to more PPE. Our reviews from our patients, we ask for continuous reviews all the time and for feedback, and it's been really positive. We hear all the time that they can tell we're taking extra measures to keep them safe, and that was our goal. Now, do I hope I can take off the shower curtain thing that I wear someday? Absolutely. It's not attractive. It's not what I like. I'm used to hugging and kissing my patients. I'm a touchy person, so that's been hard, but we're making it work. So another one of my goals with my team is to make sure they find joy or fun when they are here doing their job, right? It's not worth having a career if you can't enjoy it. And so that was hard, right? We had to start enjoying our job, wearing this garb that we weren't used to. But we're all there. We've all made it, and we've gotten through those hurdles, and we all do enjoy coming to work, and we enjoy talking to our patients still. And there haven't been any complaints about our PPE, and we haven't heard feedback that we don't have enough. So I feel like there are a lot of dentists out there who did more. They may have gone out and got the air filtration systems and stepped it up that extra notch. Nothing wrong with that. It just wasn't what I chose to go with. I have colleagues that haven't changed much at all. They're keeping their universal precautions where they were pre-COVID, and that's fine too. I think everyone has to find what their comfort measures are and what their safety measures are, and we've done that, and our patients have, responded positively.
That is so cool to hear. Let me ask this. During the restart, there was a lot of, let's just say, a lot of back and forth friction between the teams and the dentist. Also, we've heard that a lot of practices actually lost members of their team because of changing, because of fear, because of that. What was your experience with regard to that? And have you lost members of your team?
No, I'm fortunate. I have a really close-knit, bonded team that I check in with regularly. And I think thanks to my consultants and Smile Sources and colleagues, again, the people I trust, we all came to consensus that the best way to handle COVID when we were closed was to communicate with our teams and let them know what we were hearing, when we were anticipating going back, and how that would look. So weekly, I communicated with my team via email, letting them know we were coming back. There would be some changes, but I would lay it out. Then I finally typed up a comeback plan, right? So it was about 3 pages typed on what things would look like. And so everyone knew this well before coming back. And when we came back, we did half staff for 2 weeks, and we treated a lot of family and friends just to make sure everyone was comfortable in the new and what we were doing different. And then everyone else joined us June 1st. And again, I'm fortunate I didn't lose any team members. I always encouraged them to reach out if they were feeling concerned or scared or had questions. And so I'd reach out during the closure. What are we doing about this? And I'm nervous about this. And we just walked through it. And if they needed something to make them feel more comfortable, I was going to get it for them, within reason. But my girls are awesome. I love my team, and we really work on communication. So, that's huge for us. But I've been lucky. No one resisted coming back. They were ready to come back. They were bored, they were running out of things to do. And so, no, I'm fortunate, but I do know, like you said, our industry has taken a hit, even we actually needed to hire people because we merged that practice. So we needed more hygiene, and just trying to find the hygienists are hard, and the assistants, I feel like the applicant pool is very low right now. So I think we're all struggling with that.
Wow. For the practices that are out there right now, first of all, it's so great to hear that things are going well. It's great to hear there's a wonderful energy to you. I'm sure you've never heard that before. And I can see the enthusiasm about it. And it's fantastic. You gotta love it. For the practices that are out there that may not have opened yet, or even the practices that have opened but are struggling right now, or are not seeing the same number of patients, or they're not seeing the recall that they're looking for, or even if their teams are having difficulty, what advice? The communication is clearly important, but what additional advice would you want to give them to kind of help them navigate through, what you seem to be doing or able to overcome really well?
I find for me that what works is finding the doctors and the offices that are doing what I want to do and asking them how they did it. Really, that's the best advice you can get, right? So when I wanted to get into sleep, I went to my colleagues that had done it and done it well and implemented it and asked them how they did it. So if somebody's having trouble, or they don't know, we all know the hygiene slowdown is coming, or maybe it's even here for some offices. It was trying to attack that head on, right? So reaching out to my Smile Source community or colleagues, local colleagues, what are we all going to do? And leaning on each other to figure out how to get through this. There's no way I would do this alone, or could have done it alone, just me figuring this out. Never. I'm not that smart. So, I just think we have to rely on the people we trust and look up to, and that's why we have mentors, and my consultants are awesome at that. Jody and Linda, big shout out to them. It's just guiding me. And so I know other dentists, sometimes some dentists can be more of an introvert and, hermit. But I think in this type of an environment, we have to come out of our shell and talk to each other. And it's not about competition. It's about community. And that's what Smile Source is about. And that's why we all share. We share best practices all day long. And that's why it's such a unique group.
So I love that. It's consistent with what we're hearing when practices are able to kind of overcome. So I've spoken to some of your Smile Source colleagues, Dr. Mike Maroon, Dr. Louis Kaufman, and they mentioned this fireside chat thing with Trevor and the group and all the other members. Are you still doing that kind of stuff?
I would if I didn't have a 6 and 8-year-old keeping me busy at night. But They are wonderful opportunities for dentists to get on. And I will say Smile Source during the closure time when we all were closed, they offered so many opportunities for us to get together online and talk, whether it was during the day or in the evening. And these fireside chats, yeah, it's just that, is to get together. What struggles are we going through and how can we help each other? I mean, really, that is how independent dentists survive, I think, is learning best practices. And so if our members can get on at night with Trevor and talk to them about struggles or what's working, I mean, that's as important. What is working? You know, we were seeing the slowdown in hygiene coming, and Trevor was really big on keeping us all ahead of that. And so we decided to add online scheduling just maybe 3-4 weeks ago. I had looked into it a couple years ago. It wasn't the right fit for me then, but this time I thought, let's just try it, right? No contracts. They're a vendor with Smile Source. The cost was kind of a no-brainer. And it's been beautiful, the amount of people scheduling their recare appointments and new patient appointments and taking that load off the front desk. I mean, that's just one little way to help build that hygiene schedule back up.
Wow. So I'm curious, in prior to COVID, there was a certain way that you had in your mind of operating. Now that we're in COVID, and we've heard, I think Dr. Brian Laskin mentioned, COVID is an accelerator because it's kind of forcing us to adapt, do things that we otherwise had put off. What are some of the things that have really driven you, or what has COVID changed with regard to the way you are running your practice?
I can't say it's changed the way I run my practice. I'm fortunate that years ago I identified the core values of my practice, and my team knows we make all decisions based on those core values, and they're posted in several areas of the office. So I can't say that COVID, and again, patient care for me is top priority. So I'm not treating my patients any differently. I think I just look a little different what I'm wearing. But I mean, actually what I'm doing for them isn't any different. The amount of time they're spending with me isn't different. They just can't bring their family members into my reception room. And we limit how many people are at the front desk. So those financial conversations that used to take place in a consult room now just take place in the operatory. And we don't allow, a lot of congregation at the front desk. So things like that within our systems we have changed, but the patient care is the same. I'm the same person. The jokes just, I hope they're still as funny through my mask. But, I can't say changed. I mean, we're still moving forward with expansion plans that we had prior to COVID. It just looks a little bit different as far as systems. But other than that, I really think dentistry is coming back, and it's just getting adapted to these small changes we've had to make.
I love the message, and tell me if I got this right. You had systems in place, and you continue to maintain those systems, but you're also adding additional little tweaks to make sure you comply with social distancing. You comply with making sure you have your PPE. You're wearing your shower curtain. I don't know why that cracks me up. You're maintaining.
Looks like a shower curtain.
You're maintaining the focus of which is treating patients to the best ability. I think what's really important, and I just want to highlight, is the community of I guess other clinicians that you're able to share a lot of information with. That sounds like that's very, very helpful with regard to, one, reassuring you're not in this by yourself, and then also hearing what other people have tried or not tried. Did I get that right?
Absolutely. But it's kind of like when people look for reviews for dentists, or they go online and they want a new dentist, and they're asking their peers, right? They want to know experiences before they try something. Same thing in dentistry. I don't try a new product just for the heck of it. I've either heard it's really good, it's better. I've had colleagues try it with success. So same thing with any of these systems. We've created systems years ago in my practice, but it doesn't mean we haven't changed them over time. I started with 4 employees, and we have, I think there's 17 or 18 of us now. So things have evolved, And with that, we have to change some systems. But I think it's just communicating it and making sure they work and checking in on them and tweaking them as we need to do. But I mean, other than that, I mean, I won't say COVID wasn't stressful. My husband heard me screaming and crying plenty of evenings due to the stress. I just think it's what we bring here that matters. You know, we all get stressed. That wasn't anything anybody wanted to go through. But if we really dig deep and find why we come to work, I think that reasoning is still there.
How did you personally overcome that stress? How did you? It's just first of all, I'm listening to you, and your words make me smile. How did you get past that? What was it that kind of drove you there?
A lot of wine. Oh, Rolando, I don't know. I think I'm more of a positive person to begin with. I'm an optimist and not a pessimist. And that's natural. I'm sure you can tell. So for me, it was just like, I knew we'd get through it. It was one day at a time and just being responsible to take the necessary steps. I also love owning a practice and managing it. For someone who doesn't enjoy that, this would be pure hell, right? But I mean, maybe the challenge is what I'm up for. But I don't know. I have a supportive husband and an extremely supportive staff. So I do alone make things less stressful.
Have you always wanted to be a dentist?
Yeah. I'm that weirdo, Rolando. Yeah, I do not have dental family. No one in my family was a dentist, but I just enjoyed going when I was young, and I had a very nice dentist growing up. And I remember going and thinking, man, this guy looks like he's having a good time. I mean, maybe that's what I should do. And no, I shadowed a lot of people growing up, and I knew that I wanted to be a boss, right? I wanted to do something where I was in control and made a difference. And this worked out to be a beautiful fit for me. And I really have never looked back or regretted it.
You know, and that is so cool because you can see it, you can feel it. You know, I want to ask you, one of the topics that came up is during this pandemic, there are going to be practices that are struggling. And it's a phenomenal opportunity to, really start investing in your practice and the potential for growth. Are you seeing that? Is that kind of what happened with regard to this new practice that you just brought on?
Yeah, so my practice and my goal is always to treat patients the best we know how,
right,
to a certain level, right? And then grow. We want to treat more patients. We'd like for all of our area to be under care like we provide. So we're looking at growth all of the time. So prior to COVID, we were already looking at a possible expansion in my current space. And then once COVID hit and we acquired this other practice, I've actually hired another associate and we're moving forward with those plans. I think there's a lot of people out there looking for good quality care and honest providers. And so that's what we try to provide here with myself and my associates, and make sure it's done well and done with the latest and greatest technology. And so that's what we see happening. I have colleagues that are experiencing that too. And I have colleagues experiencing maybe a slower or unsure how to get through this. But, I think the resources are there. It's just being willing to talk about it.
First of all, the message you're giving out, the positivity that you have, the encouragement, the fact that you're not shy about reaching out is huge. And I really appreciate that kind of just the energy that's coming into there. It's very reassuring, and it makes you feel good. I'm blown away. I'm blown away by kind of the way you attack things, and you're just, it's incredible. Is there, if I were to ask you, is there anything that you wouldn't do again?
Well, I once had my first associate a couple of years ago was a poor choice. So yeah, I guess if I could go back, and hindsight's 2020, I would have looked into that person and I being a good match a little bit better. But I also feel we live and learn. And so after that experience of 6 months we knew we weren't going to work well together, I looked into my next associates differently, and the questions I asked, and looking at backgrounds to make sure we were a good match. And luckily, I've found good ones now. But yeah, do I wish things would have been different back then and I could have done that differently? Absolutely. But again, I probably graduated in the bottom half, Rolando. I mean, I rely on other people to get me through.
It's first of all, the success breeds success. And when you have such a drive and an enthusiasm for what you do, it brings people with you. And I can feel that with the way you're working. You're not looking back per se, you're looking forward, you're moving forward. If you were to kind of sum up the kind of the experience that you had and take into consideration everything that you've done, what would you say are the top 3 things that you would, new dentists or dentists who are starting out or dentists who already have their practice but would like to do more, what would you say are those top 3 pieces of advice that you would give them to kind of help them get over where they are and move? Because it sounds like you're there. What would you tell people?
Sure. I don't think that's too hard for me to answer. I think one is taking some training on being a good leader, because that's not a natural thing for most of us, and how to be a good leader may be different than what we think it is. So I'm consistently looking into that, whether it's reading or through my consultants. So that, because it starts at the top, right? For a private practice, it really is what we give off is what our team is going to give off to us and our patients. Then I'd say joining a group of other dentists that you trust and that maybe are in similar situations that you can talk to things about. So for me, it was Smile Source. I knew they were all private practicing dentists who own their own practices. Some had multiple, some had associates. I knew I'd find the right people to talk to and guide me in decision-making there. And then, I had another one for you, Rolando. I just think it's, training our teams too, not forgetting them and making sure we're bringing them along with us, so they know what we're thinking. If they know what we're thinking, they can stay with us on our vision. If we just do everything without communicating, it doesn't really do any good. But I mean, there's a few pearls, I suppose.
No, it's great. First of all, I'm bummed you're a little blurry here, but I can hear you. And what's really important is that message. Although your smile is absolutely stunning, and the energy that it's just, I don't know, it's just you strike me as having an incredible sense of humor. You don't take yourself too seriously, but you're a very serious person. And I have a funny feeling you have a lot of fun, but we'll talk about that at another point. But I love what you're saying. I love the message that you're getting across, and I appreciate that. If people had questions for you, or if people wanted to reach out and ask you stuff, what would be the best way for them to contact you?
Sure. They can email me directly, and it's just ellisdental@gmail.com. Those emails go directly to me, and I'm always happy to help. I might not have all the answers, and maybe seeking their advice too, but if anyone had questions about the consultants I use or Smile Source or any of our systems, I'm happy to help.
Oh, very good. And then as far as the Ellis Dental, is it multiple locations? You can just go to www.ellisdental.com, correct? And people can get information.
One location.
Awesome. Any closing statements that you'd like to share with everybody before we go?
No, I'm just happy I was able to do this with you, Rolando. It's been great.
Oh,
thank you.
I don't know why, but you make me smile. Well, first of all, at some point here, several months down the road, would you be willing to come back and then kind of share your ongoing experience and things that you're dealing with and new stuff? Would that be something you'd be open to doing? Awesome. Well,
sure.
First of all, thank you for joining us, and thank you. You are a little blurry, but I can feel you, and the feeling is incredible. So, hey, folks, really appreciate you joining us for this. Dr. Holly Ellis, you are absolutely wonderful. I love the message that you have. I love the energy. Your team sounds fantastic. If you all, those of you who are going to be watching this, if you have questions, please reach out to her. If you like the content of this, please share it. If you have any questions for us or any additional things you'd like to cover, please do that. Have a wonderful, safe, and exceptional rest of your week and weekend, Dr. Holly. It's great. And thank you for joining us.
Thank you.
All right. Appreciate it.